I don't know. Great. Thank you, Jill. I don't know, Margot, are you on the call? I think we have everyone but Margot, so we'll give her just a second or two more to get on. Well, I'll introduce our participants today, at least, along with Margot Lalich, the Public Health Director. We have Judy Geiger, Vice President of Patient Services at Columbia Memorial, and Jason Plamondon, Chief Nursing Officer at Providence Seaside. I hope I got your titles correct there. And then it looks like we have Jacob Lewin and Joanne Rideout from KMUN Coast Radio, RJ Marks from the Seaside Signal, and Eric Bengal from the Daily Astorian. So what I figured we would do is just our three presenters, if they had any just opening information or statements, to give those, and then we'll open it up for questions. I'll call on the reporters one at a time, so everyone gets a chance to ask the question, and then we'll just open it up for general questions after that. Okay, we have Margot there.
Margot.
And we are recording this conference, so we'll be posting it on our websites for the public to view also. So looks like we have everyone here. I guess, Margot, if you want to kick things off, if you just have a brief opening statement or information for us.
Yeah, I do. Good morning, everyone. Thank you for making the time, and to my colleagues, Jason and Judy. So really how I've been approaching community meetings as well as our internal updates and EOC meetings is testing cases, vaccination. Of course, we're returning to school, so there's a lot going on there. And we're starting to get questions about monoclonal antibodies. So I won't go into detail with that now. I'll answer questions that I'm where I have information. We're in week 2 of our testing event and our joint operation at Camp Rylea. It's going very well. We're testing Monday through Friday. The hours remain consistent, 9 to 1 p.m. And we're doing a lot of same-day appointments now. As you can imagine, people are waking up, they're symptomatic, or they've been notified that they're a contact to a positive case. So that's going very well, and it's a joint operation with our hospitals as well as the National Guard are providing staffing for that operation as well. Public Information Call Center continues to answer calls 9 to 5 every single day, and questions about vaccination and about testing right now primarily. And then we are, we're continuing to get vaccinations, and the uptick continues. Some of that's related to mandates. We just received some preliminary data that will help inform our planning around booster doses. So if you have questions about that, I'm happy to answer. And again, schools, we're back in session and navigating some of those expected challenges. Again, I just want to commend the superintendents for their planning. And we continue to meet weekly. It's my meeting after this one. And so I think that's it for me.
Okay, Judy, do you have some information?
Good morning. CMH continues to see COVID patients. We have had a slight decrease in the number of patients we've been admitting. So we are in process of considering taking down our COVID unit and just returning all of the COVID patients back to our other inpatient units as long as we don't get another surge of them. So that's a positive for us. Our emergency department is remaining very busy, seeing a mixture of patients with respiratory symptoms and then all the other things that bring patients to the emergency department. That's probably it for me.
Okay. Thanks, Judy. Jason, what do you have for us?
Sure. Yeah, I think we're in the same boat as CMH. We're seeing, I don't want to say a decline, maybe a plateau. We're not seeing as many COVID positive patients, which is good. And right now, but the ER stays very busy, which is interesting. So we're not seeing as many COVID positive, but the ER is getting a pretty steady flow of patients. And then we've been able to manage our inpatient flow very well through this. So right now, I don't want to jinx anything. Right now, things are looking good. Yeah.
Okay.
And then just grateful for this opportunity to be pairing up with CMH and the county to talk about these issues. Yeah.
Great, thank you. Okay, let's see. We'll first go to Jacob Lewin. Do you have a question?
Sure. I wondered what the impact is of the upcoming mandate for health workers for vaccinations on your hospitals, what you've seen, and what percentage of your employees are vaccinated at this point?
I could start if you want. We currently have about 78% of our employees are fully vaccinated, and a small percentage of employees who've had their first vaccine. So we're nervous about what will happen with the mandate. We're in process of reviewing requested exceptions for a medical or a religious reason from our employees who are not vaccinated, and working through whether we can approve those or are denying them. So much more to come.
And Jason, could you?
Sure. Yeah, this is Jason. So we're in the same boat. I don't know the exact percentages for us right off the top of my head, but I do know that right now what we're doing is we're working with making sure that we're educating our employees on the importance of this, the importance of being vaccinated, and then offering and making sure that they know how to fill out the exemptions if that's the pathway that they want to go down. And we're also then reviewing those exemptions. So we're a little nervous about losing employees, but we're working really hard to make sure that we're getting them educated and we're getting those exemptions filled out.
Okay, Joanne, do you have a question?
Yeah, I wanted to ask Judy to describe more about what the COVID unit was like at CMH. What do you mean by that, and what was that like?
Judy, are you with us? Might have lost her. Hopefully she can.
Oh, okay.
Do you have another question?
Yeah, I had a question for Jason about the national. It was reported that the National Guard was helping out at Seaside Hospital, and I was wondering if that was still happening and how long that might last.
Yeah. Yep. We do have the National Guard here. There's discussion, I think, today about the possibility of extending that through October, but for sure they'll be here through the end of September. And it's been just amazing collaboration. Really what we have them doing is we have them on our inpatient units and in the emergency room, just helping grab supplies and helping answer phones, and just kind of doing those things to free the nurses up so that they can provide care for our patients. So it's been a big shot in the arm for the staff. It feels good to know that we've got the support like that for our community. Yeah, it's been really nice.
Thank you.
RJ Marks, do you have a question?
Yeah, hi there. The numbers in the outbreak report from the state, the OHA, seem to conflict with some of the reports on the ground. Particularly, I'm thinking of at Seaside High School and Pacific Ridge, in which the staff are denying the cases. Is there some kind of, are you guys involved in that in keeping track of the numbers and seeing what's right and what's wrong? Is there somebody, sort of merging those to make sure that the correct information is getting out to people? That's for anyone.
I'm not so I'm sorry, ask the question again. So
The question is there, are you watching the outbreak reports, and are you making sure that the people on the ground that are listed in the outbreaks are aware of the fact that the state is listing them as outbreaks when they themselves are not alerting the public or deny the numbers? Is there some kind of liaison between the state and the local schools and school districts?
I'll take a shot at this question because it's complicated. There are a number of factors that contribute to the discrepancies in data. Some of it is the self-reporting. It's the only way local public health is aware of cases is if it comes through the electronic lab reporting system, which is one of the reasons why we want testing to happen at designated sites. At-home tests are a free-for-all in that an individual, an employer can conduct quote unquote at-home tests in that work site or in a home, and they see those results. They should report them, but there's no way to enforce that reporting. And so part of that can contribute to some of the discrepancies. The way we're reporting outbreak data right now, and this is a decision I made, is there's criteria for what an outbreak is, and then what the state is including in their weekly outbreak report. Our numbers are higher, and the way it's not a complex system. I go in every week to what is our statewide database called OPRA. And I go in and I look under all of the outbreaks that we're monitoring, because under normal circumstances, non-COVID circumstances, 2 or more is considered an outbreak for a communicable disease that's transmissible. So we may go and open an outbreak in consultation with our regional epidemiologist, but it won't get reported in the outbreak report. But we are monitoring it for more cases, and we monitor any outbreak up to 28 days. There has to be 28 days where there are no new cases before it's considered a closed outbreak. Now, there are entities, employers out there where we know that there are cases, because we'll get that phone call from an employee or someone who says, I know there's cases with this employer, and maybe they're not complying with isolation or quarantine, or there may be a number of things going on. And we don't take that anecdotal information and formalize it into our outbreak report. And the state may also not have that information, because their information comes from us and it comes through that electronic lab reporting system. So it will rarely is it going to be exact, because we want to have a closer pulse on what's going on. And what I will say to you, although I think it's changing, we're in a downward slope now, is that we're probably underreporting at the county level when we say we're monitoring, 21 or 25 outbreaks. That's not going to be as many as what the state is reporting in their weekly report. But we want to monitor it and have a pulse in it, because we're connecting the dots at the local level. So it wasn't a super exact answer to your question, but it's a bit complicated.
You think the state reports are valuable then as useful data?
Absolutely. And I think they're valuable because they have teams of highly qualified epidemiologists and analysts combing through all of this data and extracting all those variables that may contribute to inaccuracies. So I think it's very valuable. And I think how we're reporting it, in that we're monitoring what we know to be multiple cases in a particular employee with an employer, is also valuable because that's part of our job is to be monitoring at the local level.
I see. Can I ask, I'd like to ask another question of the hospitals. From nurses that I've talked to over the last couple of weeks, they've indicated that they're very stressed out. Is now that you're going into a downward trend, as you say, and that the National Guard is here, are you able to take some of the pressure off of the nurses, and are you hearing that they're feeling a little better about things, or does it continue to be a burden for them?
I'll go first. Is it okay, Judy?
Yes, fine.
That's a good question. I think just anecdotally, I would say, yeah, I think keeping them informed, having the Oregon National Guard here, I think those things combined have alleviated some of the stress. I think the stress comes from that not knowing, right? We don't, and the Oregon National Guard has been an extra support. So knowing that we're doing everything we can to help support the nurses and that the community is. You know, we just recently had a group of citizens come and bring treats and these drawings for the nurses, and just letting them know how that the community is thinking about them. I think those types of things really are helping relieve the stress for the nurses. So I'm seeing an improvement. I think what's really going to help is, you know, kind of plateauing or those numbers coming down.
Mm-hmm. Thank you.
Yeah, I think that my answer is fairly similar to Jason's. It feels like everyone in the community, or the majority of people in the community, are sure giving people a lot of grace these days and are doing things to show appreciation for the nurses and all of the caregivers that are taking care of COVID patients and all of the other patients we're seeing. The National Guard's a great help to the hospital as a whole. I don't know that it's making a whole lot of difference for frontline nurses because they're not clinical people.
Mhm.
They're doing a lot of things that help the hospital run where we have some vacancies in other types of positions. And the nurses are, I'm extremely glad that the COVID numbers are starting to plateau or slightly dipping down. They've been in this for a long time. And this last surge was significantly different than anything we've experienced so far with the numbers of patients we've been seeing.
I see. Thank you.
Yeah, I would like to speak, answer that for public health as well. I mean, we all know that the volunteer response has been phenomenal. And that whether we're testing or in our public information call center, that, we have many retired physicians and nurses in the community who are helping to staff that. So they're bringing their expertise and they're coming from physicians within our, our hospitals in the community. But also that sense of we are truly in this together. There was, yes, we're responding. We're responding with a little bit more, I think, certainty at this point, and have enough anecdotal information to help guide future planning. But when we look at the testing, and that truly is a joint operation, we've got the hospitals involved in it, we've got the National Guard, we have public health, and we have volunteers, and some of those are retired medical professionals, is that part of the way we cope and adapt, because we're all exhausted and fatigued, right, is that we're leveraging our assets in the community in the best possible way. And when we do that, we actually multiply our resources in many ways. And so I think it's just, we've really moved to that place, and it feels very satisfying. And the community, of course, benefits. They can get testing 5 days a week now and know where to go and what the process is. And we're all part of that.
Thank you.
Eric, do you have a question?
Yeah, sorry if you already answered this, but we're wondering why the number of virus patients caused so much stress at hospitals, what that process was.
Are you asking why by the COVID positive patients causes a stress to the hospital?
Yes. Yeah, could you go into a little bit more detail on that? That's for Judy and Jason.
Sure. I think for us, you know, the added stress is, you know, the patients that we're seeing with COVID are sicker than the patients we've seen in the past. So they're requiring more care. They're requiring more specialized care. And then the other issue is, then they require a private room. So it takes a lot of scrambling to make sure that we've got a private room available for that patient, and that we've got the space for that patient. So we have to think about things differently as COVID patients come in. Where are we going to set them up? How are we going to care for them? And so it takes more resources from the hospital to care for these patients. So I think that's kind of it in a nutshell for us. Yeah.
Yeah, I agree. And we've had to change our staffing, nurse to patient ratios a little bit with the additional patients with COVID. And Jason's right, they take more resources. They're also difficult because the nurses have to put on a lot of PPE to go into the room. Then they have to take it off very carefully to come out of the room so they don't spread any COVID. And then they have to go on to the next patient and do the same thing if they're taking care of several COVID patients. And these patients are sicker this time around than what we saw with the surge we had in November and December of last year.
Joanne, I think you had a question for Judy, but she got cut off before she could answer. You want to ask that again? Oh, I think you're muted, Joanne.
Oh, gosh. Okay. Judy, I was wondering if you could describe the COVID unit at CMH.
Absolutely. So because we were seeing an influx of COVID patients who needed a negative pressure room to make sure that COVID's not circulating in other parts of the hospital, and because we were having more of those than we had negative pressure rooms available, we had to stop surgery at the hospital for anything except for very emergent surgeries. And we turned our same day surgery unit into a total negative pressure unit for our COVID patients. And so then we could put all of the patients in one area that was this negative pressure.
Can you just describe for people who might not know what negative pressure means?
It's a way to, you keep the bad air from moving out into the rest of the hospital or outside of the area. We have these things called air scrubbers that are there, and they help get rid of the bad air from an infectious disease. That's probably not a great explanation, but maybe it'll work.
Oh, that's fine. And just how many National Guard personnel are there at CMH now, or are there any?
Oh, geez, I do not know the exact number.
This is Nancy. There's 27.
Ah, okay.
Oh, thank goodness there's Nancy to answer that.
Thank you. And then Jason, are there somewhere in Portland, a media outlet reported that you have about a dozen there, 13 at the Seaside. Is that right?
Yep.
From the National Guard? Okay, thank you.
That's right. Exactly. Yeah.
Okay. Thank you.
Guess we'll just open it up. Whoever has more questions.
I do have another question about the whether there was any bump in cases that you could, following the hood to coast. There was a lot of concern in the community about whether that would cause a spike in cases. Have either of you seen that at local hospitals?
I didn't see anything here. I don't know about CMH. I was pleasantly surprised. We didn't see that day. We were tracking our ER admits pretty carefully, and we didn't see a bump in that. And then, yeah, I didn't see a big increase. I don't know about Judy.
Yeah, I think our caseload stayed steady for the week or 10 days following hood to coast.
Thank you.
Can I?
And I
okay,
think
go
a lot
ahead.
of the reason is because a lot of those people left the community after the race was over. They had a great influx in and then were gone. So that there were people in our community potentially exposed to anyone that could have had COVID, but we didn't see much.
Judy, you said you were a little nervous about the mandate for vaccination for workers coming up. It's just basically for the same reason that Jason was talking about. You might lose personnel. And if so, are there things, if you can do things to head that off? Are you doing things to try and head that off?
Yeah, it is because we could lose personnel. I think that, the majority of the people that we would probably lose are not nurses and doctors. The majority of those people understand the science behind vaccine. I think some of our other jobs potentially are bigger groups of people who may choose not to get vaccinated and then leave their position. We are doing the same thing. I think Jason mentioned they're educating everybody. If people are asking for an exemption, we're having them meet with our employee health nurse to talk about the benefits of vaccine and discuss any concerns that they might have about being vaccinated in hopes of getting a few people to change their minds about being vaccinated.
What kind of jobs might be involved then if they're not nurses and doctors?
Yeah, it could be any kind of position at the hospital. Housekeeping. I think it's actually a mix of people from throughout the whole facility who are currently unvaccinated.
Thank you.
So I heard 78% of CMH employees are fully vaccinated. What was the number for Providence? Sorry, I didn't catch that.
Yeah, sorry, Eric, I don't have that number in front of me, so I don't know the exact percentage for Seaside. Yeah, apologize.
Is that something that you or Mike could get back to us with later today, if that number exists?
This is Mike, and I'll work on that for you.
Okay, thank you.
Thanks,
That was
Mike.
Jacob, right?
Yes.
You bet. Thanks.
Margot mentioned monoclonal antibodies. I haven't heard much about that. What's going on with that?
Well, at this point, just conversation. In fact, we have a meeting tomorrow with our pharmacy colleagues at Columbia Memorial in Providence to just talk about what we know, what's available, what's feasible in terms of the ability to provide them on a consistent basis. Again, looking at what's required in terms of infrastructure, staffing, as we've heard even in this conversation, right? There's staffing challenges. And so that's all I can tell you at this point in time. They've been rolling out and available, I think probably mostly in urban settings up to this point. So that's all I can tell you. I think that the important piece of it is that like everything else, we're going to work together to consider whether or not this is something that we can offer to the community in a way and do it very strategically so it benefits the right people at the right time.
RJ Marks here. Question, have you been seeing people using home remedies such as ivermectin or other not approved remedies? And if so, have they had consequences that you've had to deal with?
So I'll speak to what we've heard and what comes to us, but I think the hospitals are best to speak at what they've possibly seen in the emergency room. Yes, we see conversations about that and comments coming to us through social media and concerns about ivermectin. I have not received a report, and that would be something that would come to me of any individual who has taken it or some other alternative treatment that is clearly not indicated, nor is it safe for individual personal human consumption. So that's what I can say, and I'll let the hospital speak to what they've seen.
Thank you.
I don't I haven't heard anything about any specific cases of patients coming in using those remedies. Those, I shouldn't say remedies, those alternate. Yeah, I haven't heard anything.
Yeah, I haven't either. I don't think we've admitted anybody that's had a complication from doing some of these unapproved self remedies for COVID.
Thank you.
I just had a question about booster shots. You had mentioned that earlier, Margot.
Do you have a specific question or just where we are?
Just about what sort of timeline there might be and when, what's happening with that. There seems to be a lot of just discussion in media about when they're needed. So I'm just wondering what you might know so far about what might happen in Oregon.
So I think I'll start with what's required in order for us to administer any of the vaccines, and it's any vaccine, even outside of COVID, is that we have to have a standing order. And that standing order comes from the Oregon Health Authority, and it's basically a prescription, a standing order that provides guidance on who is eligible to receive a particular vaccine, because the standing order may have specificity to each one of the vaccines, of who can receive it, when they can receive it, under what conditions. And so we don't have an updated standing order for the booster doses. We do for the additional dose, right? For the immunocompromised, some of those who qualify, but not for boosters. So that's the first thing that needs to be in place, and that's not ready and available yet. The second is that there's that balance between the booster doses and also having approval to vaccinate those who are under 12 years of age. And there are two different age groups. There's the 5 to 11-year-olds, and then there are under 5 years of age. Again, there are no orders for that, nor are there approvals for that. The hope is that maybe by December all the way, or November all the way up into January, there will be authorization for the administration of that vaccine. And what we're kind of tentatively planning is for those who are 5 to 11 years old to be able to do what we've always done, which is to bring the vaccines to students and their families in the school setting, because that's the most familiar place for them. For this younger population, it could be a bit traumatic to show up at the fairgrounds. And then again, under 5 years of age, refer them to either our clinics or to their medical home. So that's where we are with the planning. In terms of the boosters, again, we don't have a standing order. We're all thinking that, end of September, going into October, we might be able to start administering those booster doses. Again, don't have a standing order, don't have approvals for that, but I do have the data. It's preliminary data. It's not released. It's only released to the local public health authorities at this point. But what that data is all the vaccines that have been administered in each of their counties, by month, by zip code, by race, by ethnicity, and also all of our vaccine providers. So what we can do is look and go, okay, back in January of 2021, this many people received this particular vaccine and they completed their series, and therefore 8 months later, we're working on an 8-month timeline interval, they would be eligible now to receive that booster dose. So that's very helpful for planning, because early on, right, it would be hundreds of doses versus later on when we were vaccinating 1,000 people at a time. So we can do some very strategic planning. And again, we have so many more providers in the community that it's not just public health administering the doses and looking at that. I mean, we administered, I think, close to 23,000 doses, just public health alone, obviously with a lot of support. So that's where we are with the boosters.
Thank you.
And we might be able to mix and match a little bit. I mean, there's some talk about that. It's not, again, there aren't any standing orders and no information saying that's actually going to be feasible, but there is conversation about it at this point in time. And the state planning assumptions are that about 80% of individuals who completed their series will opt to get the booster dose. And that leads into flu, whether or not you want to know this. We were expecting on the 13th, the annual flu packet to come from the state. And obviously that would include information of how we juggle COVID vaccinations with flu vaccinations. That hasn't been released yet. So if you have a question about flu and COVID, that's all the information I have for you at this point in time.
Right now, is the flu an issue in Oregon yet?
It's not an issue. I don't know what the hospitals are seeing. But, we saw very few cases of flu because we were all in lockdown. And so many of the interventions that we employed for COVID are what we've been saying people should do with flu for the last 15 years, right? Or certainly since H1N1. And so we expect to see more cases of flu this winter because people are out and about. And so the education will be the same. And, will we expand testing at Camp Rylea to include maybe some testing for flu? So, because the symptoms are similar, right? So we want to, is this flu? Is it COVID? Yes, we're discussing that and potentially planning for that again to try to minimize unnecessary burdens on our hospital partners.
Just one last question from me. I was wondering, with the colder weather coming, there's some feeling that people will be inside more. And do you think there will be an increase in cases because of that? Jason, you're nodding, so maybe go ahead.
Yeah, I mean, when we look at, I can look at even just what we're monitoring for outbreaks, right? And we can look at cases. There's a high level of household transmission at this point in time. And then eventually everyone in the household becomes infected. I think the important information is people are thinking, oh, if I have COVID, I don't need to get vaccinated. And that's not true. We do want people, and they are eligible to get vaccinated after having COVID. And if you've had COVID and you're vaccinated, you have a pretty high immunity. You're like the most protected of all of us, but we would expect to see more household transmission. Yeah, without question.
Can you give us a sense of the scope of local hospitalizations over the past several weeks? And is the county still posting a weekly breakdown of those hospitalizations? Thanks.
Well, the hospitals can speak to their data. We spoke to this, I think, earlier in this call, that we are wanting and continuing, hoping to provide that data. I think it's been very compelling information. There are different things that motivate the public, and it piques their attention. And this has been something that has really piqued their attention of who's being hospitalized and whether or not they're vaccinated. We know the majority of people who are contracting COVID are unvaccinated, although we're seeing more and more vaccinated cases getting COVID because it's not 100% protective. But in hospitalizations and serious illness, it's still the unvaccinated. It is motivating people, to get a dose or that second dose of vaccine. Again, we rely on the hospitals to release that data and share it with us, and so we can share it with the public. And the plan is to continue to do so as long as it's meaningful to the community.
From a CMH standpoint, our numbers started to really rise in the hospital the week of about the 7th or so of August. We had a peak of 11 hospitalized patients in the hospital. And then for the past few weeks have been averaging between 6 and 7 a day. And then just until the last couple of days, and we've gone down into more the 3 or 4 range of patients per day.
Yeah, at Seaside, I think at our peak, we had maybe 6 COVID positive patients, which is a lot when you've got just 25 beds. So, and we've been averaging around 3 to 4 patients a day that are COVID positive. But over the last couple of days and this weekend, we've been down to no patients or 1 or 2. So the numbers are looking better for us.
Those are hospitalizations you were speaking to.
Mm-hmm.
Thank you
Yes.
so much.
Could I ask a question? Because this comes actually to us and kind of gets circulated, is the public understanding at what point a case can be managed locally versus requiring that transport to Portland for a higher level of care. Could you share that?
So when
Oh, go ahead, Jason.
So is the question is when do we make a determination to transport the patient to higher level of care? Really, it's case by case dependent. So the hospitalist is in contact with Prov Portland and Providence St. Vincent's. We have a transfer center. And so the hospitalist watches the case, and then we just make a determination once they get to I mean, it really just depends on what the need is, and we're being asked now to meet the need here as long as we possibly and safely can care for that patient. But there's constant contact with our hospitalists and our intensivists in Portland to talk about, okay, you know, now this patient's at that stage, maybe we do need to bring them to Portland. There's not like a clear cut answer. Does that make sense? We really do assess that case by case.
Yeah, and I would say we do the same thing, and we actually have been keeping sicker patients here at our local hospitals just because there are not ICU beds, as many ICU beds available in the Portland area. But it's when they really need more care than we can provide, when they need an ECMO machine, which is a heart-lung bypass machine, to make sure that their body is getting enough oxygen, or the ventilators that we have, we've maxed out what we can do with them to help support a patient being able to breathe well enough. Or if they have a lot of other comorbidities that are causing issues with trying to take care of them. So yeah, it's an individual patient by patient.
Does anyone else have any other questions?
Yeah, I have a question perhaps for Margot. I don't know if you can even answer this, but the expectation that I've been reading is that this Delta variant will die down by the end of September. So what happens after that? I mean, can you even speculate that, or are we waiting for another variant to arise, or could we maybe think that normal might happen someday? Or I know that's a really wide question, but I just ask if you had any thoughts about it.
Yeah, I think that, and it's not my thought, but with my colleagues across the state, is that, you know, we have another year of writing this out, right? We're back in school. We feel, you know, we've been in this pandemic for, you know, it seems like a very long time. Yet, believe it or not, we're still learning many new things. In terms of the efficacy of the vaccine, right? Will booster doses make a difference, right? How it's going to interact with potential flu season, what's happening with the pediatric population. So we're still learning a lot, and coronavirus and this particular, these particular strains will continue to circulate, I think, at some level. And yes, they Once you get a certain level of transmission and infection rates prevalence in the community, you're not going to see it as much, but they are monitoring for other variants. And I think the sentiment at this point is don't get too comfortable, because we're not sure what's gonna present in the months to come. And so I think while we're partly in recovery, we're still very much in a response mode. We're also planning for the unexpected. So that's my answer at this point.
Thank
And I
you.
think we're going to be masking for a while. That's always one of the questions, right? Is we're going to be masking for a while, and we know masks, well, nobody likes wearing them, and they do make an important difference.
Thank you.
Any other questions from anyone? Okay. Anything else any of our three participants wanted to add?
I just wanted to thank the county and Judy, for the collaboration to talk to everybody about these important issues. So thank you. And I was going to say we should, whatever Margot's prediction was going to be, we would have to hold her to it.
Yeah, I agree with Jason. This has been just an amazing collaboration between the two hospitals in our area and the county to make sure we're doing the right things for all the community members.
Well, that's all the questions we had and all the information. Appreciate our local media joining us, and we are hoping to make this a every other week event to provide you with all the updated information. There's obviously a lot changing all the time, so we know we'll have new updates to give you in 2 weeks' time. So thank you, everybody, for taking part, and we will plan to see you again on whatever 2 weeks from now is. Thank
Whatever
you.
that is.
Thank you very much. Thank you.
Thank you.
Thank
Everyone.
you.